picked up the dog and been like, here, look at this.
Yeah. Which the good news is I feel like that televet, even after this ends, we'll probably still keep that up for certain types of appointments. So, silver lining, something good came out of it. We've, extended our services that way. So,
Welcome everybody to another Zoomcast episode of Why Richmond is Awesome. I'm Alex Glazer, local real estate agent. We have Sam Knipe with the Richmond Experience here as always. Thank you for joining me again. And today we're talking with River City Veterinary Hospital, specifically Heather, the client service manager, and Kritien, the managing LVT. How you girls doing today?
Good.
Doing well. How are
I
y'all
like your
doing?
masks.
Thank you.
Very trendy, yeah.
You still got to show some kind of personal flair when it comes to your PPE.
Exactly.
I love it. I'm digging it. So this is my vet, actually. This is where we take Charlie and Chance. We've been going to see Dr. Anthony and the whole team at River City Vet Hospital for quite a number of years now. I feel like we're there all the time because Charlie is a disaster dog. And thank God Chance just is an angel because we're always there with Charlie. But how are things going? For people that aren't familiar with River City Vet Hospital, do you guys want to give us some background on you guys and where you're located and sort of what you do on a daily basis?
Yeah. So River City Vet Hospital has been here. We opened up in June, so 6 years ago, June.
6 years.
And so we're located near Willow Lawn, near Libby Avenue on Broad Street. And as far as, normal practice goes, we have changed a lot of things since COVID-19 has started. We're not allowing clients into the building. So we're doing curbside procedures.
So curbside pickup, we've got all of our parking spots numbered so clients can call us or text us. We have a separate cell phone where they can text us to let us know that they're here. And then we've got this whole communication going on between us, the front staff and the assistants, let them know their appointments are here. Yep. We ask clients questions before their appointments, just their little health questionnaire, just to make sure that everyone that we're coming in contact with is relatively healthy. So we can, protect the staff and also protect our clients and just keep everybody happy and healthy while we try to conduct business as much as possible.
And we don't have the PPE so personal protective equipment. We don't have that for clients that have been exposed or are positive. So we have created a bunch of different, we're using telemedicine is the word for that, a bunch of different options for people like that. So then our staff is not being exposed to anybody, but also at the same time our clients aren't dealing with staff that has been exposed to somebody else as well. So we have a pretty big level of PPE. The couple of things that we don't have the N95 masks, we don't have full body suits. So we're using surgical gowns, we're using face masks, we've got eye protection, we've got caps, gloves obviously, but the big things we are unable to handle, so we've started things like we have a televet portal, so we're doing video chat with clients to talk about their pets, kind of holding their pet up to the camera and showing us them and showing their issues and discussing their issues via video chat. And being able to talk to them without them having to come into the hospital is a huge step for us.
Yeah, and we're doing, so we also are doing mailing meds to clients. We started delivery, so anybody who needs something delivered to them within 5 miles of our hospital, they get free delivery. We'll deliver up to 15 miles for just a very small fee, So just ways, we've been brainstorming ways every day to how can we help people follow the stay-at-home order, but also get them what they need, like preventatives and food. Because we have a lot of elderly clients, immune-compromised folks that they don't want to leave their house, and so we'll bring it to them with contactless delivery. So it's been working pretty well. So
that's awesome. Yeah, it's a big practice. I mean, I feel like every time I'm in there, there's always a lot of people in there. You guys have a big staff. Everybody's always smiling and happy. So it was probably a really weird transition when all this stay-at-home stuff happened to be okay, no more clients in the building. I guess it's almost like a drive-through, it sounds like now, and doing a lot of telemedicine, which I feel like that was around for, medical doctors, were doing it somewhat, but this is probably the first time that you guys as vets have picked up the dog and been like, here, look at this.
Yeah.
Which the good news is I feel like that televet, even after this ends, we'll probably still keep that up for certain types of appointments. So, you know, silver lining, something good came out of it. We've, you know, extended our services that way. So
yeah, it's something that we've talked about it a couple of times for specific appointments, you know, that the patient's not needing to be handled or treatments needing to be done or diagnostics being done. You're just kind of having a conversation and being able to visually look at an animal. They're wonderful and it's very user friendly. But what you were saying, Sam, so in the veterinary world, it's really not common because the patient can't tell you what's happening. Where in human medicine, that's something that can happen. They can tell you their symptoms and explain them. In veterinary medicine, there's a lot of physical examination and visual examination. But it's crazy that you say that because all of the companies are constantly contacting us that they dropped their televet app or they're opening up their telemedicine application. They've got a new website. So it's like we had 3 in the past week that are companies that we use that are opening up their own platforms.
Wow.
So are you all seeing the same amount of, you know, patients every day in terms of like dogs and cats? Is it more? Is it less?
So no, it's definitely less because we are only seeing like urgent care appointments. So patients that are sick or due for rabies vaccines, for instance, because that's, you know, required by law to have your pet vaccinated for rabies. So it takes a lot of just kind of brainstorming each phone call you get throughout the day, trying to feel out the situation. If it's something that's dire that, you know, involves them having to leave their house, or can we utilize televet, or can a doctor get on the phone and talk with them, or a licensed tech? So definitely less appointments, but we're still busy because we, you know, have a huge clientele that come here. And, you know, so it's still busy, just not as much as the, you know, typical River City.
And we've also limited our appointment time. So
Yes.
we are normally starting appointments at 8 a.m. until 6 o'clock, 7 o'clock, depending on what day of the week it is. And now we've limited appointments from 9 a.m. to 5 p.m. With that, basically what we're giving ourselves time in the morning to accommodate for any appointments that are coming in, prepare for anything that's coming in that we do need to wear personal protective equipment for. And then also at the end of the day, that gives us 1 to 2 hours, depending on the day of the week, to be able to disinfect thoroughly every single surface, let it be able to sit overnight. So we're able to prepare and make sure that we're cleaning everything that we need to clean, getting everything prepared for the next day, limiting the amount of like rushing that we're doing between things. So we're just trying to accommodate time. We're seeing we have 15-minute block offs in between appointments to give ourselves time to either, sometimes it's taking a little bit longer for checking them in outside and then bringing them inside, having them checked out over the phone, calling the client. There's a lot of phone calls that are happening back and forth, whereas normally you have the client in front of you for your exam to be able to discuss findings and recommend treatments, etc. So there's a lot of that. So we have block offs in between. So theoretically our appointments are 30 minutes with a 15-minute break in between each time. So we're definitely, it's fewer appointments, but for the purpose of making sure we're keeping our staff safe, the hospital clean, and keeping our clients safe.
So just a longer process, really.
Oh, yeah.
Have you seen any changes? Like, I know, you know, we're home every day now with our pets. So like, you know, for example, Chance has been having some dandruff, and so we're able to like better treat his dandruff because we're just around him more, so we can spray him more and give more baths and do all of those things. Are you noticing like a change in how people's behavior in terms of like caring for the pet, or things that they're able to do at home with the pet? You know, otherwise you're like running off to work and, you know, you're going in a million different directions. And so that can sometimes be hard to like take care of the kids in the house and the, you know, yourself and then also your pets. Have you guys seen any changes?
I mean, I would say yes, because people are home and so they're noticing things about their pets they may not have noticed. Or, you know, I will say like nail trims, for instance. We've been doing more of like coaching clients on how to do it themselves at home, just because that's kind of not really an urgent thing, unless of course the pet is in pain or something, then of course we could get them in. But just routine nail trim. And it's funny having conversations with people because they're like, all right, so you're going to get a towel and you're going to make a kitty burrito. And they're like, a kitty burrito? And you're like, and you're like, yes. So then they do it and they call back and that worked. I never knew I could do that. I'm like, see, we're going to get through this together.
Yeah, for I feel like on the other kind of more emergent situations, you have patients that are coming in that need treatments more often at home. So clients are actually more able to give them more medications in a short amount of time. So every 6 hours instead of every 12 hours, or every 8 hours instead of every 12 hours. And then things like giving fluids at home, they have more time. They have more time to be able to learn, watch a YouTube video on something, and to be able to do it at home and feel comfortable with it. So I think I've seen a difference in that. And then on top of it, you're spending a lot more time, so people are noticing a lot more things going on with their pets. So they're seeing bumps that they didn't see before, or noticing different habits that their pet has, that kind of thing. So I've definitely seen a lot. People are definitely loving on their pets a lot more, which I'm sure the pets are loving.
Yeah.
And I imagine, like, with the whole telemedicine portion, me personally, I'm probably an overreactive pet owner, where I'm like, oh my God, is that okay? Should I take him to the vet? I don't know. And like, luckily my best friend, and she lives with us right now, is a vet tech. So I'm able to just be like, hey, is this okay? And she's like, yeah, no big deal.
Yeah.
But if she didn't live with me, I'd probably be kind of like going to the vet more than I should. So like, even having this option now, but especially down the road, I feel like I'd be very helpful for overreactive pet owners like myself.
Yeah.
I saw a really funny meme that was circulating, I think, on Facebook, and it was, I think, a vet tech that was like, everyone, male dogs have nipples. Those are not ticks. I thought that was so funny, because I guess people are just paying attention more to their dogs, and all of a sudden they're like, oh my gosh, my dog has a tick, and it's like, no. It's just a male dog with a nipple is all. We've tried cutting our dog's nails too. It's funny you brought that up, and it's like, you want to snip like the tiniest bit at a time, because you're like, I don't know how close I'm getting here. Like, we're playing with fire, I feel like.
I appreciate clear nails. I've never had a dog with clear nails, but one of our dogs does. So you can see the quick. I'm like, so much easier.
Oh yeah.
So much easier.
All our other dogs have like solid black nails, and it's like you feel like you're doing roulette. You're like, how far do I go?
Exactly.
Is it what's the powder that'll stop if you go too far? Like septic?
The quick stop, or
Styptic powder.
Styptic powder, yeah.
I made sure to get some of that. It's only happened once or twice and wasn't that bad, but it made me feel a lot better because it works really quickly.
Yeah.
It does. And it's nice too, because then and they bleed too. So it's nice for anyone to have that at home, just in case.
But yeah, in my experience, a distraction is helpful. So like, we'll use lots of peanut butter, and while they're eating the peanut butter, they're less paying attention to their paws.
Oh yeah.
There's a new trend now. I've been seeing it all day long. People are wrapping saran wrap around their heads and then putting peanut butter on the front and then trimming their dog's nails. I don't know if I would advise that 100%, because your face is a little bit too close to their face and they don't love it.
Oh my God, that's funny.
I think it's funny.
We tried like the peanut butter in the bath, because one of our dogs is like not a bath dog, but she just was so disinterested. Like, and we couldn't even get her close enough to the wall to like bathe her and let her lick the wall, that I was like, this hack doesn't work. But I feel like there's got to be something else, some other sort of hack that you can come up with to help with bath time routine.
Probably just whatever that dog likes. Give them that. So if they're not super, excited about peanut butter, find something else that they would get excited about.
Yeah.
Some dogs they're finicky. Like our dog Miko, sometimes I'll have bacon and she's like, I don't know. Every pet's different.
Yeah. Yeah.
I feel like every dog would love bacon.
Oh yeah.
Yeah.
Bacon.
But I don't know. Sometimes she gets in these weird like emo moods where she like won't eat a treat, and I'm like, you're probably the only dog in the entire world.
Probably.
How are you guys determining like what would be a telemedicine call, and when do you bring the pet in, or do you kind of do like phase 1 is a telemedicine call, and then you kind of determine from there, like, you're going to have to bring your pet in. And I guess it's maybe been a little difficult for people because they're not coming into the building, right? And so it's like, if I have to come drop off a sick pet or an injured pet, I guess, what is the process? We're kind of just giving the reins over to you guys. I guess that's a 2-part question, but what is that process like?
So there are only really one kind of appointment that anyone in the hospital can deem as a televet appointment, and that's for patients that need refills of controlled substances. That's something that the human medicine, they do the same thing for controlled substances. They've kind of started out with everything, but by law they have to be seen every 6 months. So that is the only one that we are deeming absolutely anyone can make that decision to schedule a telemedicine appointment. Other than that, it's a huge conversation. The management, we have 100%, we come together on everything, but it's run by basically case by case basis. Everything that you get on the phone, we will talk it out together. We'll talk it out to the owners, the office manager. It's definitely a big teamwork decision, and every case is different.
Yeah, and even then, like you said, first phase telemed, and then if the doctor, is talking to the client, it's like, well, maybe we do need to see this pet, then we go from there. So kind of a mixed bag at this point.
And we've been telling the clients too, so when they do the consultation for televet, obviously there's a fee, but once the examination is over with, if the doctor's decided that patient needs to come into the hospital, we have been waiving that fee. So when they come in, they're not getting charged for 2 exam fees. We've definitely made that a big thing too. Voicing that to clients before they even have their appointment. There's a possibility with this case that you may need to come into the hospital even after the televet appointment for procedures, or for the doctor to just be able to do a physical exam. So that's the one thing that's been a little bit limiting in it.
Yeah.
That's really nice. Yeah, I didn't even think of that, but yeah, I guess it would be rough to have to pay two different fees, for both of those things. I guess you guys are planning on seeing an influx, once we get past this, and people are able to kind of go out and about again. I guess you'll have a lot of patients that are coming in for like their routine annual things, because you're probably not really taking a lot of those at this point. Mm-hmm. Same with like dentists and some of those appointments.
Yeah, definitely limiting the annual appointments and just kind of going down to what's urgent, or like I said, the rabies vaccines, and it's kind of you have to kind of decide after all, because of the pet's lifestyle and stuff. So we had that discussion with them. So the phone calls are definitely longer, but you have to kind of, talk to each client a little bit more and find out exactly what that patient needs and go from there. And then they come to us and to the owners and to our office manager, and we, again, just work it out together to see what the best course of action is for that patient.
And on top of that, the other end of the spectrum that we sometimes forget about is surgeries too. So we've been limiting kind of like elective procedures, so spays and neuters, unless they're deemed medically necessary by the doctor. So we have been limiting those, and our amount of surgeries are definitely diminished throughout all of this. But our dental cleanings are keeping us going on the surgical end. But we will have a lot of phone calls, not only just for annuals coming back after all of this is over with, but for regular elective procedures, spays and neuters and such.
How have clients been doing? I mean, I know it's like a lot of changes, and has everybody been pretty receptive?
Clients as in pets, or clients as their
Well, yeah. I guess the pet clients are always really the same, right? Yeah. No, people clients.
Yeah. I mean, for the most part, everyone has really applauded us, because we started this, I think it was like, March 16th. So right when things started really going down in Virginia, and they applaud us, they call us and check in on us, and the conversations on the phone have gotten longer, because I think we're all so used to seeing each other in the lobby and like having those conversations and checking in with each other, because like all of our clients are like family to us. So we get them on the phone and we're like, oh, hey, how's it going? And how are y'all doing? Or if I bring medicine outside and I see someone, they have their dog in their car, I'm like, I'm blowing kisses from afar. I can't wait to see you in the lobby again. So, but for the most part, I mean, I feel like our clients really have been respecting and just admiring that we have gone to this extent to keep everybody safe.
We do really feel lucky. Dr. Anthony and I were talking about this earlier. Our clients have been just so kind through most of this, or through all of it. They're willing to do whatever we're telling them to do. They're coming in, they're parking, they're not trying to come into the building. They're being so patient with us as well, because like we said earlier, the process of it is taking a little bit longer. I have a friend that brought her pet, and she just said she felt so anxious not being able to be with her. But people are still just being patient, waiting in their cars, playing on their phones, whatever they're doing, just waiting for their appointments to be over with, and just being so receptive of it. And we talk about it almost every day. We have so many clients that are family to us, and we miss them. We want to be around them. We want to be able to talk to them. And, give them hugs and everything. And so it's very hard for us, and I know it's hard for them as well.
Yeah. I will say, didn't we have a client in a lounge chair out in the parking lot? We had her drink chopped out.
I like it.
A little camping chair just waiting for her pet to be done. We're like, all right, that's cool.
That's
A lot of people waiting in the car. I guess if it's a shorter appointment, or are they going home and then like coming back?
So all of our appointments are still regular appointments. They're still waiting in the parking lot. So when they get here, they call us or text us, let us know that they're here. We have numbered spots around the building, and then they hang out during their appointment. Again, the appointments are usually about 30 minutes still. So they hang out, the doctor calls them after their examination, and then we get whatever treatment's done, whatever medications that need to be filled, call the client back, get payment over the phone, and then bring the pet and medications outside.
Sounds like you guys got it down pat. That's awesome. It's nice to see you guys were able to shift so quickly and get something in place. I mean, I know not everybody, not just in the vet industry, but across all different kinds of businesses, we're slower to pivot. And so it's cool that you guys were able to kind of get some of these processes in place. And I'm sure it's gotten better and easier over time too. So that's really cool.
Yeah.
You're doing a great job.
Yeah, I think a big part of it is too, Dr. Anthony, the veterinary industry we talk about all the time is a very small world. But so Dr. Anthony and the other doctors here all have friendships and acquaintances, and talk to people that are in different companies and at different hospitals, and kind of bouncing ideas off of each other and seeing what's going on. There's so many veterinary support groups out there too, to kind of see what everybody else is doing and making sure that everybody is kind of doing to the best that they can. So I definitely think we've taken bits and pieces from every single thing that we see and trying to implement them to the best of our ability.
That's cool. I think that's all I have, Alex. If you have any more questions for them, I think they're doing a great job, and it's awesome to see, and it's good that all the clients and everybody's been so supportive.
Oh yeah. Well, we can't go back to normal and be able to see everybody and get to love on the animals a little bit more, and just have that family vibe again.
I do want to give a big shout out though to our staff.
Yes.
From owners to management to doctors to assistants, receptionists, everybody is, we are throwing them things, multiple things every single day that we're changing policies, making new policies, changing everything. People are separated around the hospital, so they're not even as close and talking to each other as closely as they were. Everyone's kind of separated a little bit more. So everyone has worked really well together and made a big team effort to be supportive, and people are, going above and beyond, even in positions that aren't, responsibilities that aren't their position. So everyone is really, we would not be able to do this as smoothly and cleanly as we are doing right now, I feel, without our staff.
Absolutely.
You guys are still running a full staff?
Relatively. So with the 9 to 5, we only have a certain number of people here in the morning, certain number of people at nighttime. We have enough staff to get what we need to get done every day. So we definitely, our schedules have changed drastically. But everyone is still working as, pretty much any day that they normally would be working, they're working. They just have shorter times that they're here.
Yeah.
Did we go over like your website or anything like that? I don't know if we gave out that information. Sam, do you remember?
I don't think we've covered it yet.
Do you girls know your website offhand, or I'll just look it up and put it at the bottom?
Yeah. It's rivercityvethospital.com.
Perfect. And then you guys are at River City Vet on Instagram, or is it River City Vet Hospital?
I think it's River City Vet Hospital.
Okay.
And
Awesome.
you post pictures of cute dogs and cats on there?
All day, every day.
Yes.
Those are the type of accounts I like to follow, so I'll check it out.
So you need to follow us.
We have some very cute patients.
We do.
Thank you guys so
Awesome.
much for chatting with us.
Of course,
Yeah.
thank
Yeah.
you.
Thanks for
We
talking with us.
appreciate it.
All right, well, have a great rest of your day.
You too.
Bye.
Thanks for listening. Why Richmond is Awesome podcast is hosted by Sean and Sam Knipe of the Richmond Experience and Lauren and Alex Glazer of the Glazer Group Realtors. It is produced and edited by Miles AG Productions. Our theme song is RVA All Day by No BS Brass Band. Please rate us and leave a review on iTunes or wherever you listen to podcasts. And follow us at whyrichmondisawesome.com and on Instagram at The Richmond Experience and at Why Richmond is Awesome.